Michelle. It's great to see you. What are you wearing?
I have on the headband that is available now on sleeptakeout.com with
It's
Bluetooth
violet.
speakers for sleep. I'm actually making it act as a headband right now. But remember, if you are trying to go to sleep and you want some audio, you can pull it over your eyes. And again, I can't see and I really can't hear a lot of outside stuff. So you got to put it back up. But it has the Bluetooth speaker that will pair to any of your iPad or your iPhone or any Android device. I want to make sure we throw that out there that we're not just Apple friendly. So yeah, it's available right now. So cute and really comfortable. It just doubles as a headband, which
Yes.
who
I
can't use
love
that?
it. And where do our listeners and watchers go to get one?
Sleeptakeout.com, our new website, which is
Oh
really
my
great.
gosh.
So
Well, we just have
just
to
go to the top right. It'll say store and go shop over there and go pick yours up.
I love this. This website, people, it's been a journey, but like I'm excited. Like Michelle spent hours trying to figure this out.
Hours.
And then we had AI help us figure it out and we got it. Like super excited. So
So,
did
on
I love
today's episode, we are going to talk about sleep testing, particularly at home sleep testing. Remember, millions of people have sleep apnea and they don't even know it. But the thought of going to a strange clinic, sleeping with wires glued onto your head sounds absolutely terrible. So, are those at home sleep tests that you actually see online worth the money?
Oh my gosh. I know, Michelle. And I've done both. We're going to talk about this. We're going to talk about this. So welcome back, Sleep Nation, to Sleep Takeout. I'm Dr. Daniel Baughn, and I'm here with our sleep medicine expert, Dr. Michelle Zetoony. And today we're going to break down the at-home sleep testing today. But right off the top, we do want to remind you that our sleep takeout coloring book, that was my like drum roll, but better, is now available for pre-order. Go to sleeptakeout.com to order your copy of the Sleep Takeout Coloring Workbook. It is
So
officially
excited.
available. Yes, we're super excited. We custom designed it to help you disconnect from screens when you can't sleep. So we are both super excited about this. But yes, go to sleeptakeout.com, go to dosleep.com. You can order it there. We are super excited for you. So, all right. And Michelle, sleep studies. Like, take us through this.
Okay. So when you go see a sleep specialist, or even if it's your primary care doctor, and you think, hey, I need a sleep study because I'm not sleeping well, they will give you choices. And the difference between seeing a sleep specialist and maybe your primary care provider, your endocrinologist, all of whom can order sleep testing, is the difference between something that you take home and do it at home. They might even have one in their office to send you home with, versus going to a sleep center sleep clinic, which is technically called a polysomnogram, and that's an in-lab sleep test. So things that you need to know about home testing is home sleep apnea tests have been available since like the 2010s. 2008, 2009 was really early ones. Since 2010, it's been standard. And thank goodness, because around the pandemic, when all the sleep labs were closed, and then this whole Philips recall, which again, many sleep labs were closed, universally, home sleep testing really just took off. And unless you have a subset of medical problems like congestive heart failure, you have advanced lung disease, or you're a child, for most people, a home sleep test is all that they're going to be offered, either from a sleep clinic with a sleep specialist like myself, or a primary care setting, or even your dentist can order sleep studies. So there's those differences in the testing. Home sleep equipment was measured for measuring sleep apnea only. So if you think you might have sleep apnea, a home equipment is generally the right thing to start with anyway. In-lab sleep testing can look for a lot of other sleep disorders like sleepwalking and other parasomnias and seizures in your sleep, or limb movement disorders, or something that we try to get away from, but it's called sleep state misperception, where people believe that they're not sleeping all night, and then they go to a sleep lab and they also say, I didn't sleep at all. And technically, by brainwaves, we're actually recording that they're sleeping. So There are certain reasons why someone may need a bigger sleep test, but for the most part, looking for sleep apnea, we're going to be ordering home sleep testing. The convenience of being able to do something in your home, having minimal wires, being in your own bed, much more affordable. These are all the positives
Mhm.
that can come with a home sleep test device. Unfortunately, the negatives sometimes outweigh the positives, depending. The main one that I typically see is one of the sensors will fall off in the middle of the night, or the battery will die in the middle of the night, and we don't get any information. We also don't know if you're awake, you're asleep with many devices, particularly the ones that are offered through in-lab clinics. They purchase the type of devices that are, I don't know, for all intents and purposes, they're glorified monitors of monitoring your heart rate and your oxygen level. If they include the airflow cannula in front of your nose, it'll look for airflow. But many of them now are just telling you whether you're on your back or your side and what's happening with your heart rate and your oxygen. So without this EEG, we don't even know if you're actually asleep. There's another device that I think, Daniel, you're gonna show me, but this is the type of device. It's called peripheral tonometry. It's another type of home equipment. But with this one, it has movement sensors in it and a muscle sensor, so it infers if you're sleeping without having the brain waves on there. So show me you're unboxing a home equipment that you have
I am,
received.
because I'm gonna do a take-home sleep study, although it's already been confirmed I do have sleep apnea, we've known that, so, and I've actually done Michelle, I've done both types of sleep studies. I've done both an in-lab one, and I've also done an at-home one, and, and this one does have, the oxygen, a pulse oximeter type of, like, monitoring thing, um as well as the movement. And, one of the things that I think is really kind of interesting, and this happens a lot, especially when I've talked to clients about an in-lab sleep study, is are a few different things. Number one, you are sleeping in a bed that's not your own. So the real question is, how accurate is your sleep in that environment, when you're doing the in-lab kind of study. The other thing is you usually show up late at night. You're like there at like 11 p.m. and then you fall asleep, but they hook you up and the electrodes and there's all the gel that's in your hair and all this stuff. And then you've got tons of wires coming off. Now, granted, they do see your brainwave activity, which is a clear benefit of the in-lab one. Um, but the other thing that happens with in-lab ones is that sometimes you'll be like, "Did I even fall asleep? Like, I don't know if I got good sleep at all." But then you'll get back the sleep study and it said you slept for an hour, and so we're gonna, base our conclusions off of your sleep for an hour or something. Like, tell us more about that, Michelle. Of like, you spend all this time, energy, investment. You went to a lab, and then you're like, "But I slept for an hour. What did it find?"
Yeah, I mean, I think a really important part of the intake when they're scheduling these in-lab sleep studies is finding out what your preferences are. So I know the sleep centers that I read for here, if you delineate that you go to bed typically around 10 or 11 o'clock at night, they will oftentimes have you come in around 2 hours or so prior. You're filling out some paperwork like you are with any medical setting. They orient you to, your bedroom, your bed, your room. So you're unpacking like you would unpack at a hotel room. You're also encouraged at the time you schedule to go visit the sleep lab, so you can kind of understand the lay of the land, where the nightstand is, where the bathroom is, and you can have preference of if you would like to be closer or farther away from the bathroom. Because you're getting to this point is we want it to be the most similar to at least the home away from your motel or your hotel type of experience as we can. And sleep testing, just like any other testing, it's not meant to be, your perfect every night sleep. It's meant to get enough hours of sleep to make a determination of what's going on. So anything less than 4 hours of sleep is not actually even a billable type of test. In the sleep centers that I read for, we almost ask the technologist not to score that testing and to invite the patient back for a different night test. After 2, 3 hours of not sleeping in the middle of the night, that person, if they're deemed okay to drive at that point. Sometimes they're almost hysterical or really tired. They're just dozing and not sleeping. They'll finish the test, but they actually will say this, we didn't get enough information. So 4 hours is the cutoff. They have you there for at least 6 or 7 hours. So if you're not sleeping for half the time, they really shouldn't score it. It's not a billable procedure. So the sleep lab should not keep going through all the motions and sending it to the interpreting doctor and to the technologists that are the scorers the next day if they won't be able to bill for it. They technically could, and then they just get denied and kicked back. But from a patient perspective, you know that you're not going to believe anything that's deemed after an hour of sleep. And I know from my standpoint, if we base everything on indices in terms of sleep apnea, how many times did you stop breathing or partially stop breathing per hour? And you got such a small amount of time, which is that per hour component, it's gonna make the time that you stop breathing twice in an hour seem a lot more clinically significant than it really is. We all stop breathing when we sleep. That is not sleep apnea. The syndrome that needs to be treated, that is sometimes how our bodies are going to process our CO2 levels while we're sleeping. So it is abnormal to have apnea. That's not the obstructive sleep apnea syndrome. It's how many times we do this type of apnea. So you're exactly correct. If a home test doesn't tell us about your sleep and we do this whole night test knowing that you're awake for half the night and your test comes back that you don't have the sleep apnea syndrome that you've been accused of having for years and years, we're not going to stop looking for an answer to your breathing problem at night, but we won't have any way to actually treat a condition that we haven't identified with a test. So that might answer your question and maybe other people's questions on what do we do with the information. If I
Cool.
took a blood test after eating a breakfast of scrambled eggs, bacon, and bread and butter, and I forgot they were taking my blood test with being fasting, I would not trust that cholesterol panel that comes back really high is accurately predicting something that I wanna treat. If it's high, is it high because I just ate and I wasn't supposed to? And if it's not high, do I wanna still base that knowing that I don't really trust that information because I just ate?
Right, exactly. I mean, and I think this does bring up one of the real advantages of an at-home, environment where, maybe there's a little less anxiety around, the actual, getting the test done in your own bed. You're in your own home bedroom. It might be a more normal night of sleep, especially for some of our people that we know are kind of naturally anxious. Um, and so that's why I'm excited. I am going to test out this take-home sleep study here. So we're gonna, wear the watch pad, and I see this is the heart rate monitor too. So I'm excited.
That's the snoring channel, but they'll talk to you all about that, where you put a piece of tape kind of on that area so it senses vibration.
Perfect. I'm excited for it. I mean, I think it's never a bad idea to know more information. And I mean, it's kind of exciting. Like, it's almost like these at-home tests, there's a spot for them. There's a place for them. It's a great starting point for, really starting to detect that moderate to severe apnea. But I mean, as you were saying, it's also important to understand what the limitations are of both types of looking at
Yeah.
this kind of piece of the puzzle there. So,
And
and
even though there aren't a lot of wires on there, I mean, a lot of times we will still tell people maybe a night or 2 before you wanna actually do your test, maybe put the watch on your wrist if you're not used to having something on your body. Don't, turn the app on, don't start testing, but maybe like a couple band-aids around your finger to mimic what is gonna be on your finger. And really normalize the fact that, you do this all the time. We're just trying to observe in a sleeping type of setting without anesthesia or drugs or medications on board to do this. But in the anxious person who we already know this and they're still anxious even taking it home,
Right.
I oftentimes will invite them to do something that they can do when they're anxious
Yeah.
to do the testing. So whether or not that's a medicine, again, we don't love that, but if that's something that they're comfortable doing, then they do that. But maybe listening to an audiobook before they go to sleep, maybe, you know,
Absolutely.
desensitizing to them to the testing.
Absolutely. Well, 100%. Like this is where the wind down routine for the anxiety that's helping. If the anxiety is interfering with what we call your sleep latency or your ability to fall asleep at the beginning of the night, this is when wind down routines can be super, super helpful. And this always is kind of, a helpful part to remind our listeners and our watchers too. If sleep apnea isn't your issue, but maybe racing thoughts are keeping you awake, either keeping you awake when you're trying to fall asleep or keeping you awake from trying when you're going back to sleep in the middle of the night. That's really where CBTI kind of comes in. You can always head over to my website, www.danielbond.com, fill out that, quick form to schedule a phone call, check sleep takeout, for priority booking. And then we can definitely get to the bottom of it. This is anxiety kind of keeping you awake, alert and awake, and how to best redirect that energy.
Yeah, and if you're struggling and you need a sleep test, make sure you talk to any doctor that you've been seeing. You do not need to come see me as a sleep specialist. Talk to your dentist, talk to your primary care doctor. If it's about your child's sleep, talk to your child's pediatrician. But if you're struggling with those nighttime awakenings, and you really just need something and a process to kind of wind down outside of bed, consider getting the sleep takeout work back at thedeosleep.com. It's the perfect screen-free tool to help your brain wind down.
I love it. I'm so excited about our workbook, the coloring book. It's amazing. Like yes, we can't wait for you, Sleep Nation, to see it. And maybe we should have like an unveiling party too. Like, oh wow. We'll we'll
I don't
we'll,
know.
we'll keep thinking. We'll keep thinking.
We'll
All right.
definitely put some pages into it into our tired but not sleepy boxes when we do those again.
Mm, absolutely. Like a sneak peek, like a mini version or a custom edition. Ooh, that's what we'll do. Custom edition for our target about sleepy boxes. All right. Until next time, Sleep Nation. Bye.
Bye.